How long should you wait before getting intimate with your partner? Plus, does a popular male enhancer really work? I'm sure a lot of our male viewers would like to know. Everything you wanted to ask about sex but didn't. Now you can ask Dr. Leah, sexual health expert and associate professor in the Department of Health and Human Performance. Here she is, our very own Dr. Leah.
Thanks, Derek. It's great to be here today with all of you. I'm Dr. Leah Janine. We're here to answer your questions about sex and relationships. We have a lot of the latest research and a little common sense. Plus, we have a special guest here to reveal what you want to know about vasectomies. But first, let's take on some viewer questions.
Beautiful. Here we go, Dr. Leah. A woman says, my husband wants to try new things in the bedroom, but I'm used to being submissive. How can I get out of this habit and try something new? You go, girl.
Well, yeah, there you go. Well, whether your husband wants you to take more of a lead in the lovemaking or he wants you to dominate him in the bedroom, there are a few things that you could begin with. Start with a conversation about what you're both expecting. If he wants you to take charge in your lovemaking, then think about being a seductress or maybe being a tease. Tell him what you would like him to do to you. Decide the position for sex. Tell him what feels good. If nothing feels good, guide him to do something that you'd like him to do instead. Once you get used to voicing your desires, it will become easier to take the lead.
You know, Dr. Leah, one of the constants of your recommendations and advice is always communications. Communicate with your partners. And in this case, what specifics should they discuss?
Well, if your husband wants you to dominate him during sex and you're willing to do it, give it a try. Do talk about, though, where those boundaries would be. This will give you a chance to imagine what it would be like and also contemplate how to do it. Definitely decide on a safe word that will give the submissive partner a way to let you know if it's time to stop.
Here's a safe word, stop! You know?
Yeah, but not if that's part of the kink role play, right? So you're gonna have to think of something that you wouldn't ordinarily say.
Well, that's why you're the expert, okay. And any tips, since they may not be comfortable with this just yet, Dr. Leah?
Well, after both people are on the same page and he still wants you to dominate him, start with small steps like maintaining eye contact but telling him not to look at you. Talk dirty, but only after you've discussed what words are off limits. Let him know what he's doing to please you, but also let him know if he's doing things that simply aren't right. Does he want you to be talking down to him or praising him for his compliance to your desires? Like, does he want you to throw in, that's a good boy, right? You need to know what he's wanting.
Okay. A viewer says, my throat burns during sex. Is it possible to be allergic to semen?
Well, if your throat burns while having sex, it could be a semen allergy, but that is rare. Semen can affect the skin around the genital area, and that area comes in contact with it. But it can also affect your whole body if that's what you have. It could be a systemic allergy to semen.
Okay, and let's say they're not allergic. Are there any other symptoms?
Well, if that's what you have, you might have difficulty breathing or swelling on your lips and tongue.
Is there an allergy test for this?
Yes, there are tests that you can take to discover if what you're experiencing is in fact an allergic reaction. Or you could just use a condom during sex and see if the burning continues.
Okay, so let's just assume that they are allergic. What can they do?
Well, if there is an allergic reaction to semen, there are medications like an antihistamine, or you could try a desensitizing treatment. While a semen allergy isn't curable, treatment can help you reduce the symptoms. You should definitely speak with your doctor to see exactly what's causing that burning in your throat.
Always check with your doctor, like we always said.
Absolutely. You want to eliminate any possibilities of STIs.
Beautiful. Good advice. A man wants to know, Dr. Leah, for our next question, how long should you wait before having sex with your partner? Is there any benefit to waiting?
There is no clear answer, but according to a poll of people, right, most people, so this wasn't professionals, most people felt that a couple should wait at least a week, but less than a month after they started dating. About 10% think it's fine to have sex within a week of dating, but there is a lot of hypocrisy here because when couples who are married or in a serious relationship were asked, 15% said they actually did have sex within a week of dating. Another 19% said that they waited more than a week, but less than a month to have sex with their partner. Again, this is when people were polled. These were not trained professionals. This is just other people's perceptions.
So obviously it has to be different for men and women, correct?
Yeah, not too surprisingly, men and women have different feelings about when to have sex. About 38% of men believe it's okay to have sex within the first month of dating, as opposed to only 20% of women. Only 7% of women think that having sex in the first week of dating is fine.
So what are some of the pros and the cons of waiting?
Well, there can be some benefits to waiting, such as getting to know the person you're dating better, and holding off can increase the sexual tension, and that can make the sex more pleasurable when you have it, but it can also create more pressure when it comes to the big day. Sadly, I think all too many women hold out because they feel it as though that's what they should do rather than what they want to do. So if you're not ready after a month, keep waiting. If you want to go for it the first night, then go for it. I wouldn't want to be with anyone that would judge me for sleeping with them too early because it takes two to tango. But again, it's unfortunate that there is a perception and there is a double standard towards women.
Still to come on Sex Talk. Sex trafficking in the U.S. Vasectomy 101. Talking about sex with your doc.
Unfortunately, sex trafficking has made plenty of headlines because it's a serious public health problem, even here in the United States. See if you recognize the signs and know what to do.
Oftentimes, people assume sex trafficking is only an issue in less developed countries. However, sex trafficking is a global issue affecting both developed and developing countries. While it may be more prevalent in some regions due to socioeconomic factors, it knows no boundaries and exists in every corner of the world. While the majority of sex trafficking victims are women and girls, men and boys also fall prey to this crime. It's crucial to recognize that any person, regardless of gender, can become a victim of sex trafficking. And contrary to popular belief, many victims of sex trafficking are not forcefully abducted. Traffickers often prey on vulnerable individuals, exploiting their vulnerabilities and manipulating them into situations of exploitation. There are several indicators of trafficking, like bruises, changes in mood or behavior, disconnecting from friends and family, lack of freedom, or being coached on what to say. There may be situations where individuals can help others. Possible questions to follow up on red flags include asking, "Where do you sleep and eat?" or "Have you been hurt or threatened?" Other cases may require immediate help from law enforcement. There is even a national human trafficking hotline equipped to help anyone from community members to victims themselves. And don't forget about protecting yourself. Individuals can prioritize their physical and mental health, as traffickers often target vulnerabilities. Becoming proactive about your health and the signs of trafficking are just a few ways to improve awareness and a step closer to reducing this worldwide crisis.
The key here is that issues like this are preventable, and we can all do our part in increasing awareness. Still to come, a doctor talks us through the experience of getting a vasectomy and what we need to know. And a viewer is feeling anything but pleasure after having an orgasm. That's next.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about Sex Talk. Go to askdrleah.com.
Welcome back to Sex Talk. Today we have male sexual and reproductive medicine specialist, Dr. Josh White. Thank you so much for joining us.
Thank you for having me.
So we're going to talk about vasectomies today. How do you explain the procedure and what should your patients expect?
Yeah, so vasectomy is basically where you're trying to block off the tubes that bring sperm from the testicles up into the ejaculate. And so most of these are done through a small opening in the scrotum, and it's typically done in the office. They typically take about 15 minutes to do or so, and guys are always worried about the pain of it, and what we tell them is that, usually the pain isn't very significant. It's very easy for us to say that because we're not the ones that are getting it done, but we use freezing on both of the cords as well as the skin before we open it up. And so guys can kind of expect to have to kind of feel like they got sack tapped for maybe 3 or 4 hours after the procedure. And then the next couple of days, they may be a little bit more sensitive down there than otherwise. But generally speaking, it's tolerated really well, and guys do really well with it.
So I know men always worry about how it affects their sex life. So what do you say to reassure them?
Yeah, so one of the most common questions that we get is, how is it going to affect my ejaculate? And the one thing that's important that we always tell guys is that, the majority of ejaculate volume comes from the seminal vesicles and not from the testicles themselves. And so, we tell them that your ejaculate volume is going to be largely unchanged. And after that first, week or two after the procedure, when they shouldn't have intercourse or masturbate or anything like that, after that, it's a very normal. Should have no impact on erectile function, no impact on their testosterone levels, and no impact on the pleasure of sex.
So what are some things that might make it fail and cause the person's partner to become pregnant?
Yeah, so typically, if there is an early failure, that generally speaking is a failure of the procedure. Either the vase itself wasn't clipped, or a clip fell off, or a tie fell off, whatever the case may be. So, in those first 3 to 6 months, that would be the most common reason. And then for longer term, nature finds a way in about 1 in 2,000 patients that get it done. And we have, even after they've had, after the vasectomy, they've had semen analysis that show no sperm. For whatever reason, things reconnect and they can get pregnant. And so we always mention that to them. And realistically, it's probably less than that, but that's kind of the numbers that we quote. That's the evidence that we have available.
Okay, and so how common are reversals? A guy changes his mind,
yeah.
He meets a new partner. How common is it to get a reversal, and how successful are reversals?
Totally. So the data that we have suggests that 6% of men who get a vasectomy will ultimately request a reversal. And there's the pregnancy side of things is a little bit tricky because the vasectomy reversal is only half of the equation. And so, but based off of the best data that we have, in the first 3 years after a vasectomy, the likelihood of becoming pregnant is about 80%, and then that number slowly decreases over time. But in terms of there being sperm in the ejaculate, so the male side of things being taken care of, it's about 90 to 95% effective.
Okay, awesome. So is there any other thing that you should let our viewers know about this procedure?
Yeah, so probably the most important bit of counseling that we give men is that, if in the first 3 months you would still be considered fertile. So if you think of my arm as the vase, if we put a clip right here, all of this portion of the vase still has sperm that are viable. And so you either need to wait for the sperm to die, which takes about 72 days, or you need to flush out the pipes. So some people will say have intercourse or masturbate 20 to 30 times, but generally speaking, we repeat a semen analysis at the 3-month mark, and then we let them know if they're good to stop using protection. So using protection in those first 3 months is critical.
Awesome. Well, thank you so much.
Thank you.
We'll be right back with more Sex Talk.
Still ahead on Sex Talk. What can affect natural lubrication? Yoni massage tips. Talking to your doctor about sex. Semen concerns. What's red boost powder? Stomach discomfort after sex.
Back here on Sex Talk, let's take on some more questions from our viewers.
Beautiful. A woman says, I don't get as lubricated with my current boyfriend, even though I feel more connected to him. Is it a bad sign, though?
It's a fairly common problem for women, so it's not a bad sign. There are some reasons that it may be happening. The most common reason women have decreased vaginal wetness is hormone issues. There's also childbirth, breastfeeding, menopause, and premenopause. These are all some of the things that can get your hormones out of whack. Some medications or medical treatments can do it too.
Dr. Leah, what else could it be?
Well, possibly not engaging in enough foreplay, taking the time to let yourself get aroused to increase natural lubrication. Or maybe he's not hitting the right spots during foreplay. And you might have to just guide him along. If you're a smoker, that could also be a part of the problem. Smoking can decrease blood flow, and since vaginal lubrication results from increased blood flow, you'll have less lubrication. Another reason could be stress, making you feel anxious or nervous. Try some exercise or meditation and see if that helps.
Dr. Leah, just like in anything in daily life, medications can have an effect, positive and negative. If she's taking medications, could that be causing some of the dryness?
Absolutely. So one of the most common ones you take is an antihistamine, right? It's what you take when you are sick or you're trying to just not clog up your body. Well, it has a drying effect on the entire body, including the vagina. There are also some types of antidepressants, and most often those will affect the levels of the neurotransmitter serotonin, like selective serotonin reuptake inhibitors. All of those can also contribute to vaginal dryness.
Dr. Lee, our next question. A woman wants to know, what's a Yoni massage and how does it help with sex? I want to know too.
Well, Yoni means vulva or vagina in Sanskrit, and it roughly translates into sacred cave or sacred space. A Yoni massage can help people feel more in tune with their body. It's one of the many tantric practices that people use, so it can be beneficial in your sex life. While it's not the goal of the Yoni massage to reach orgasm, some people say that it can lead to multiple orgasms.
Multiple orgasm, that sounds pretty good. Can men have this multiple orgasm thing? I mean...
So interestingly enough, a lot of people believe that there is a long refractory period for men, and in most men there is a longer refractory period, but not all men. Some men really don't have it, so meaning that they could remain erect and have another orgasm again. But again, that's pretty rare.
Okay, but it's not as frequent or as quickly as a female, for example.
No.
Okay.
No.
Dr. Leah, you mentioned Sanskrit. What is Sanskrit?
Well, Sanskrit is the sacred language of Hinduism. So it's the language of classical Hindu philosophy, and it's in the historical texts of Buddhism.
And how does it work?
Well, a Yoni massage can be done either alone or with a partner. If you do it by yourself, you want to set up a comfortable space to perform it. You could do it on a bed or a floor, but put a pillow behind your head and one under your back. You want to lay on your back with your knees bent and your legs apart. You want to warm up by essentially touching your body, including your breasts, belly, and thighs. You want to have some lube or some massage oil handy. The technique also involves using your fingers to massage your clitoris and labia by making small and then large circles around the clitoris, pushing and pulling and rolling the inner and outer labia and cupping your hand over the vagina and massaging the whole area with the palm of your hand.
You know, this is going to be might sound like a typical male question, but you said that the goal isn't really to reach orgasm, so what's the point? You know?
I'm kind of with you, Derek.
Okay.
I'm right there with you. No, but it is supposed to be an emotional journey rather than a sexual one. It can help people feel more comfortable in themselves by exploring and developing their relationship with their body. So a non-sexual internal massage can release tension from the vagina, smooth the stagnant muscles, invigorate your body with blood flow and circulation.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about sex talk. Go to askdrleah.com.
When it comes to health issues, you go and talk to your doctor. The same goes for sexual health issues. Here are some ways to ease those topics.
Even though doctors can help, many people feel uncomfortable or embarrassed to talk about their sex life with their healthcare providers. Initiating a conversation about your sexual health can be challenging, but it's important to remember that doctors are trained professionals who are there to help you. Understand that discussing your sexual health is a normal part of medical care, and your doctor will approach the conversation with respect and confidentiality. It may help to prepare yourself before your appointment. Think about any concerns or questions you may have regarding your sexual health. Reflect on topics such as contraception, sexually transmitted infections or STIs, libido, fertility, or any sexual pain or discomfort you may be experiencing. Writing down your questions beforehand can help you stay organized and ensure you cover all your concerns during your visit. If you feel uncomfortable discussing sexual matters with your current doctor, it may be worth considering finding a healthcare provider who specializes in sexual health or has experience in the field. Look for doctors who create a safe and non-judgmental environment, fostering open conversations about sexual health. Some doctors also offer appointments online, allowing patients to receive care in their own homes. These types of appointments may make it easier to discuss sensitive topics, and if you need extra support, consider bringing a friend or partner to the appointment. Keep in mind that it's a doctor's job to help, and they see multiple patients a day who likely have similar questions and concerns. Ultimately, the doctor's office is a safe space to discuss health needs, and your sexual health is no different.
Being honest and open is the best way to get information and personalized treatments to optimize your sex life. Now let's take on some more questions.
Okay, here we go. Next question. A man says, my sperm is very watery. Does that mean I'm infertile?
Watery semen is often temporary and can resolve on its own, but if it's persistent, it can indicate a low sperm count or another condition that could, in fact, affect fertility.
And what would cause the low sperm count?
If the reason is a low sperm count, some of the causes include hormone disorders, drug use, excessive alcohol use, smoking, certain medications, and of course, genetic conditions. Besides a low sperm count, there are other reasons for watery semen, like engaging in sexual activity multiple times a day, a zinc deficiency, or the swelling of the veins that run from the testicles to the scrotum, and diseases that can cause semen quality in some people.
And what can they do about that?
Well, treatment for watery semen depends on the underlying cause and can include antibiotics if an infection is determined to be the cause.
We'll move to our next question, Dr. Lee. A woman says, I want to know if my boyfriend who has type 2 diabetes and who has erectile dysfunction can safely take Red Boost powder. I saw a video about it online. What is Red Boost?
Red Boost is a dietary supplement and is made from natural ingredients, including an amino acid called L-citrulline, that may boost nitric oxide levels in the body. Nitric oxide relaxes blood vessels and can increase blood flow, which can help improve erectile function. Another ingredient in Red Boost is horny goatweed. We all love that name. That extract has actually been used for centuries as an aphrodisiac. It contains a compound which has been shown to improve sexual functioning by increasing blood flow and enhancing nitric oxide production. Keep in mind that these studies are mixed as to the effectiveness, and prescription drugs may actually be more beneficial in treating ED. So your boyfriend should definitely talk to his doctor about whether or not Red Boost would interfere with any other medications that he's taking.
Our last question, Dr. Lee. A woman says, I feel nauseous before I orgasm. What's going on?
Well, there are several reasons why you might feel nauseous after an orgasm or after sex, including dehydration, pelvic inflammatory disorder, urinary tract infection, and having sex too many times. If you're also experiencing breathing problems after sex, definitely see your doctor immediately. Another reason you could be feeling nauseous is vasovagal fainting. It happens when your partner penetrates very deeply, touching your cervix. Since the cervix is filled with nerve endings, it can trigger vasodilation response that can lower your heart rate and blood pressure, making you feel faint and nauseous. Endometriosis is a condition that makes the tissue similar to the tissue up the uterine lining, but it grows outside of the uterine cavity. This can also cause some people to report having nausea. You could also have what's called post-orgasm disease syndrome. It usually affects men, but it can occur in a small percentage of women. Some of the symptoms include blurred vision, mood changes, and feelings like you might have the flu. While doctors aren't really sure why people have this syndrome, they suggest that it might be due to an autoimmune condition. Also, anxiety or stress can produce feelings of nausea. If that turns out to be the case, try to relax before you have sex by either meditating or exercising. All right, well, Derek, that's all the time we have for today, but you can still send in your questions. I'm Dr. Leah Janine, and we'll see you next time when we answer the questions you've always wanted to ask on Sex Talk.